ABC Radio
Brisbane and Queensland.
This is ABC Radio Brisbane and Queensland.
Now, when you've got a throat infection and you're given antibiotics, you're told to take the whole course. It's not just an arbitrary request from your doctor. The aim is to stop those bacteria from becoming resistant to antibiotics. And that resistance is becoming a big problem. In fact, our first guest this afternoon has warned of a catastrophe if something is not done to address this problem. Professor Dame Sally Davies is the Chief Medical Officer for the UK, and she's here to speak at the Solutions for Drug-Resistant Infections Conference. Professor Davies, thanks for your company.
Thank you. It's good to be here.
Can you just begin, I suppose, by explaining where does this resistance to antibiotics come from? How does that work?
Well, it's absolutely natural. You have an infection. We have infections, and you expose those bugs to an antibiotic. They are changing all the time, making new children, new progeny. And as they do that, they can get changes, mutations in their genes, which, if it means they can live when the antibiotic's there, will then mean that they become resistant and the whole colony becomes resistant. So it's a normal process, but normally we hope that people will only take antibiotics when they need them and that they have a high enough and long enough dose to kill them off without this happening.
So if that's your hope, it sounds like that's not the reality.
No, let's start with the story you told of people going with their throat infections. So I can talk to the English data where I know that 1 in 4 of those people probably need an antibiotic and 3 in 4 will not benefit from one. Moreover, by taking an antibiotic, they're exposing the bugs in their gut, and we have more bugs in our gut, our friends as I often call them, than we have on our skin and than we have of our own cells, and they can become resistant just because we took the antibiotic. And then we usually get those urinary tract infections as women from our own gut, and we may have made ourselves have a resistant bug.
So clearly there is bacteria out there that is resistant to the antibiotics that we have available currently.
Yes.
So what's the solution?
Well, the solution is to only use antibiotics when they must be used, because clearly they're life-saving. Everyone wants effective antibiotics, so we need to diagnose people effectively. We need them to use the antibiotics when they're needed properly, not stop halfway through a course because they feel well and then start taking the other half when they feel ill another time in a few months. And that means we don't need as many courses of antibiotics as people are generally getting.
So I'm just wondering, when did this resistance as a problem begin to attract the attention of brilliant minds such as yours? When did we notice that we were developing a problem associated with antibiotics?
Well, it's an interesting story because penicillin was discovered by Alexander Fleming, who got the Nobel Prize. And in his acceptance speech at the Nobel Prize, he predicted resistance would happen, and it happened quite quickly, and people would die. And yet we have abused antibiotics, and it's been going up and up, the problem. But now I can tell you about patients in the UK who are getting drug-resistant gonorrhea. And
Whoa.
Your listeners might say, well, I'm not, indulging in activity to get gonorrhea, but we don't want that in the population. We've got people with cancer getting infections that are resistant. So far, generally treatable, but not always. Probably not many patients with multi-drug and extreme drug-resistant TB in this country, but we see a fair amount of multi-drug resistant TB in England,
right.
And it's difficult to treat.
So this is what's given rise to the concerns about diseases that we thought we'd effectively stamped out in the Western world, certainly, making a bit of a comeback.
Absolutely. You put it really well.
Well, That is a real concern, because I feel as though we've been hearing the message about the proper use of antibiotics for certainly as long as I've been old enough to take myself to the doctor and ask for some assistance. Why isn't the message getting through? Is it that, we've got doctors who are overprescribing because they're hurried? Have we got people who, as you say, aren't following the directions on the label? Why is this going on?
Well, it is really difficult, that doctor-patient relationship, when you're rushed and the patient really feels validated when they're given a drug. And we don't have good rapid diagnostics. If we had a rapid diagnostic, even one that took 2 hours, and you could just wait and see, would it benefit from an antibiotic? That would be fine, but we don't.
Okay.
The diagnostics take on average a couple of days, and people by then want to have gone back to work well. So it's a multitude of different things, but the behavioural issues are key to this.
Professor Dame Sally Davies, Chief Medical Officer from the United Kingdom over here in Australia, to speak at the Solutions for Drug-Resistant Infections conference happening at the Brisbane Convention Centre. Look, this idea of a superbug, you maybe alluded to it a little earlier. These aren't necessarily bacteria that are new bacteria. They're bacteria we may be familiar with that have been given superpowers because of our super abuse of antibiotics. Is that the situation?
That's right. There aren't new bacteria, but they keep acquiring new genes that protect them against the treatments we're giving them. We want to kill bad bacteria that are causing infections. We want to keep our healthy bacteria in our guts and our bowels, and they keep changing. And it's partly because we use the antibiotics badly. We use them when they're not needed. We use them at too low doses. We don't take them for the right length of course.
So is this now the role of government perhaps to step in and try and cause some sort of behavioural effect in the population? Who do we look at for answers?
Well, it's a problem for the whole community. But let me tell you a few of the things our government has done. We started by putting it on our national risk register next to pandemic flu and terrorism. This matters, and it's only going to get worse. But then we looked at what we could do in the National Health Service, and we incentivise hospitals with money to reduce prescribing use of antibiotics, and it's working. We did a behavioural study. Over my name, a letter went to half of the top quintile, that's the top 20% of general practice prescribers, just saying you're prescribing rather more than other people. They reduced their prescribing not only in the 3 months after, but a year later by 3%, because we highlighted it to them. So we're making all sorts of different approaches to try and reduce prescribing, while we hope that through research funding and working with the pharmaceutical industry, we'll get new drugs. Because the pipeline's empty. That's one of the other problems.
What do you mean the pipeline is empty? There are no new drugs on the
next
market?
to nothing coming through. We haven't had a new class of antibiotics come into clinical use since the late 80s. I mean, this is an area where people had stopped investing. It wasn't sexy.
Okay.
And people thought the genome revolution would sort it rather than help take it forward. And we have what's known as a market failure. We don't pay very much for antibiotics, so there's no profit to be made.
Okay. See, I always thought it was big business. That's why I regretted not studying chemistry, but I suppose it's the right kind of business that people are looking at, and making people healthy, curing them, maybe.
Well, they don't use as many drugs when they're healthy, do they?
And see, and that's another problem too, isn't it? The overprescription of antibiotics isn't necessarily leading to this environment of superbug, but it's also meaning that some people who need a particular antibiotic maybe cannot access the medicine they require. Is that something that you've sort of also looked to address in the United Kingdom?
So in our countries, if they need antibiotics, they'll get them. But in Africa, India, China, there are people dying because they don't get antibiotics. That lack of access is terribly important. But for us in the West, it is overuse, excess use, that matters, because that's driving resistance.
Mm-hmm. Professor Dame Sally Davies, Chief Medical Officer for the United Kingdom. Now, you are here to speak at this Solutions for Drug-Resistant Infections, the conference that's happening. What are you excited about when you look at the other people who are involved with this conference? Because it's really a meeting of minds, people who are trying to affect change in this area.
Well, it's a great conference. I mean, you need to be reminded that you here at the University of Queensland have some of the best researchers in this field in the world. And they brought together a lot of really great people to discuss the issues and their research so we can all learn from each other. I think we will make progress. The title is Solutions, and that's what we're all looking for.
Do you have hope that we can find a solution? I mean, it's very much on the United Nations agenda. In fact, last year, I think it was the first time that it was really discussed as something urgent that needed to be remedied. It
was. We were very proud that the United Nations Heads of State Week had a day on this, and they just announced 2 weeks ago their new interagency coordinating committee, and I'm honoured to be one of the conveners of that to try and help drive action, because we know a lot of what needs to happen. Mm-hmm. How do we get not just governments but the practitioners and the public to do it? And that's the crux of it, while we're developing new diagnostics and new drugs at the same time.
So what are some of the actions that you'd like to progress?
I would like us to move to a system where drugs are used but only on prescription, that they're high quality. That may happen here and in the UK, but not around the world. And we have to look at the whole world issue. I would like to move to a situation where we have a rapid diagnostic, so they're used when we know what we're treating. I would like us to have new drugs in our armatorium so that we can go and get them out when we need them. There are so many things to be done, and we need political will and money.
You mentioned that we need to look at it as a global issue. Is there a commitment? Is there a worldwide commitment? I know the UN has flagged it, but are you seeing people really coming to the party?
Yes,
okay,
but
great.
It's like climate change. This is really complex and muddled. The great thing is that no one disputes the science or the problem, whereas in climate change there are deniers and disagreements. But it is that complex, and many countries say, well, you in the north say we should do X, but you didn't do that, so why should we now? So we've got to work through the development issues, and one of the big overuse areas is in animals. In fact, it happens in this country. Over 70% of your antibiotics go into animals for growth promotion. Now, there are other ways of doing growth promotion. We in Europe have banned it in about 2004, and our meat yield is fine. And we're not risking the development of new antibiotic-resistant drugs and their passage into humans.
Professor Davies, as someone who really is a leading mind in this particular field of research, this idea of what would happen should we have antibiotic-resistant bacteria. Can you, just to bring it home, paint a picture of what our world might look like if this problem is allowed to continue unabated?
So if we don't take action now, we will lose modern medicine. So a scratch on your face from shaving, and you could get an infection that's untreatable and die. You would go to the cancer doctor who'd say, well, I've got a modern drug that'll treat your cancer, but you'll get an infection. I can't guarantee you will live. You could die of the infection. Caesarean sections, new hips, operations like that rely on antibiotics. The increasing number of people with diabetes who get infected ulcers, get other infections, those will be much, much worse. It's modern medicine that is at risk here in every area of it.
Well, it's certainly very disturbing, but there's hope so long as we've got fine people like you. And you've just been listening to some cracker insights from Professor Dame Sally Davies, who is the Chief Medical Officer for the United Kingdom, here to speak at the Solutions for Drug-Resistant Infections Conference. We'll have a panel discussion a little later this hour with some of the other leading minds from the conference. But Professor Davies, thank you so much for your time.
Thank you.